your kitchen. Shop La Familia, 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
Radio Ansar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is on you that we worship and is your guidance that we seek. Ya Allah, keep us on a straight path. Ya Allah, show us your choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. We welcome our listeners on Radio Al Ansar, CIA Radio, Voice of the Cape, Radio 786, Sirius Radio, Sirius FM, Radio Islam, and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is stress management, and our very special guest is Dr. Nazia Iran Osman. Nazia, assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for joining me in the program this evening.
Wa alaikum salam, Faisal, and to all our loyal listeners of Radio Al Ansar. Jazakallah for having me.
Absolute pleasure, Nazia. Just to introduce our guest, Dr. Nazia Iran Osman is an independent board-certified clinical psychologist registered with the Health Professions Council of South Africa. She has extensive work experience within the clinical field from working in various hospitals within KZN and is currently in private practice. She has completed her PhD as Doctor of Philosophy, and her research topic was using mindfulness-based stress reduction techniques with health professionals during times of intense stress, namely COVID-19. She treats all psychiatric and psychological disorders and helps clients with any personal, professional, or societal challenges they may experience in their life, so they may live to their highest potential. Assalamu alaikum wa rahmatullahi wa barakatuh to all our listeners, and it is Medical Files you're listening to. This is an interactive program. Any questions for Dr. Nazia Iran Osman shall be forwarded to us via WhatsApp on 060-904-1056. Now, Nazia, can you tell us a little about yourself and what led you to become a clinical psychologist? I normally start by asking who or what is a clinical psychologist, but I'm sure it will lead to this.
Yeah.
Let's go to it.
So I think a big thing is I'm going to go with the difference between psychiatry and psychology, because often, there's a bit of misunderstanding here. And psychiatry will be medical doctors who actually train and can give patients medication, and they focus on getting information to help them, with the physiological part, which is meds. And a clinical psychologist comes with what makes us different from other psychologists is that we can work with some of the more serious mental health conditions like depression, bipolar, and things like that. We don't handle the meds, but we handle, their thinking, we handle the emotions, we handle the behavior. So we handle the lifestyle, shall we say.
Can I say you try to talk them out of it?
We try to gaslight them out of it. Okay. I use the word, but no, yeah,
Okay.
we always use talk therapy, absolutely. Why I chose this field? I think there was always an interest in human behavior and mental health. And I always have the story. I think about being an only child sitting in the back of my parents' car. And I'd sit and look at people in other cars and I would create stories about them.
Okay.
And I'd always be wondering, like, why that expression, or what's the story behind that person, or why is this, So I was very curious about the working of the mind and people's stories. So that's what got me here.
Okay.
All confessions.
No, of course. Now, you told us why you became a clinical psychologist, but what inspired your interest in stress management as a field of study?
Okay. So I think it was my own health struggles that actually brought me here, because I think at that point I was diagnosed with an autoimmune condition.
Okay.
And very oddly, I had mouth ulcers, which if anybody has, it's quite painful for 6 months.
Okay.
And at that point, I had heard about mindfulness and I started practicing it on myself, mindfulness-based stress reduction, which is a series of like an 8-week program where you have to do meditation and learn to be attuned with your body. And alhamdulillah, it had such a massive difference in my life that I started studying this further. And I was curious about, okay, does it help other health professionals? And that's how I got into this thing with stress and trauma-related disorders and mindfulness and how to use the body and mind to calm ourselves down. So I learned it through not just my professional interest, but how it helped me in my personal life.
Okay. Very interesting. And, it just reminds me that if one of us are experiencing some sort of problems, then we can look to therapies of this nature,
Yeah.
and it can have an influence on us.
Yeah,
Yeah.
absolutely. And if you think about it,
Mhm.
who does not suffer from stress? Like stress is so pertinent. It's
That's-
everywhere. I mean, how
yeah.
do we avoid a life
Mhm,
or
mhm.
have a life without stress? It's
Yeah.
very hard to avoid.
Absolutely, absolutely, absolutely. Now, you speak of stress. How do you define stress, and how common is it in today's society?
Yeah. So I think because of our lifestyle, stress is extremely, extremely common. And it's not just about, think about the old people. They did everything manually or physically, but yet it didn't seem like they were as stressed as we are.
Mhm.
And I think we underestimate, how much of information overload we are having. Leave alone TV. If you look at our screens, you're just scrolling in a few minutes. There's so much of information that's
Yeah.
bombarding your system,
Mhm.
and it's too much for the brain to be able to cope with this. Now, I'm going to get a little bit into the definition of stress because I think we use it so flippantly. Like, okay, I'm stressed now. It's a
You're
verb. It's
stressing
a
me out now.
noun.
Yeah, you're stressing me
exactly.
out.
I'm stressing you out. So it's a verb. It's an adjective.
Yes,
It's all
absolutely,
right.
absolutely.
But stress, it came up in the 1930s by an endocrinologist who noticed that how do the hormones fluctuate when they're under pressure? So that's where it came from and became more commonly used in the 70s. But I'm going to come with stress as a process. So I'm going to explain it to you, and then we'll be able to understand it more as we go along, like stress management. So the process of stress is, first we will appraise, is this a threat or is this a challenge? And if it's a challenge, then I don't get that stress because it's okay, I can handle this, right? But if it's a threat and I feel unsafe, then I go to my secondary appraisal. Can I cope with this or not? Do I have the skills? If I have the skills to cope with this, it's okay. Even if it's stressful, I can manage. But if I don't have the skills to cope with this, then my system becomes overwhelmed.
Okay.
Yeah, does that make sense? And
Yes, it
also,
does.
if I'm like, while I'm assessing this, and just say I have the ability to cope with this, I can do I'm sure people have heard about this, the fight, flight. Have you heard of that? The fight or
I
flight?
heard of the fight or flight. Yes, yes.
And
yes.
there's more. So there's fight or flight. Like if I think I'm strong enough, I'll fight you. If I can't, I think I'm fast, I'll run.
Okay.
There's also fawn, fight, flight, fawn.
Fawn.
Fawn is
F-A-W-N.
F-A-W-N. I think of this as a deer batting its eyelashes to a lion and going, I'm your friend.
Okay.
So fawn is when I try to make good with you. I try to be friendly. I try to play nice. I try to play small. And the most upsetting of this whole one, the one where we are totally overwhelmed, is freeze. So it's fight, flight, fawn, or freeze.
Okay.
Yeah?
Okay.
Make sense?
Yes. Now, when you freeze, what happens? You've given up hope now.
So freeze is
move.
a very interesting state. Yeah. So, so in animals, we see that they play dead. So that's what's freeze. But in humans, when we become overwhelmed and we can't manage, or we think this is beyond my coping mechanisms, the brain just kind of goes dull. But also, that's where we get dissociation, depression, numbness, burnout. So the freeze state is where some people live, unfortunately. So if you have chronic stress, then you actually go into kind of a chronically frozen state.
So you perpetually got that fear factor in you.
You perpetually have that fear factor. And how do we know you are frozen or numb or dissociated or depressed? You're not creative, you're not connecting, you're not flowing, you're not taking life as easy. You're just constantly on the state of, I'm waiting for something to go wrong.
So what are some of the most common causes of stress that you see in your practice?
Okay, so the most common cause, that I see are work-related pressures. And, just some research, they say about 75% of people who are affected by work-related pressures will say this oozes into their personal life as well. So it's quite hard to keep these kind of pressures in one space and compartmentalize it. We also see a lot of family dynamics, health issues, financial concerns, people juggling responsibilities. We're in an era where everybody is just constantly busy. I was listening to Jay Shetty today, and he was saying everybody has at least 60 to 66 projects they're working on in a moment.
Yes.
And I thought, wow. I mean, is that? And I'm counting in my head how many things I'm working on. So we're not just talking about work, but we're also talking about work, home, the different roles and responsibilities you have. Imagine a computer with 60 tabs open. That's a lot, right?
It's going to freeze.
It's going to freeze, exactly. So I think we're all managing quite a bit. One of the assessments that I use to check for stress, it's called the Holmes and Rahi stress scale. And it checks about how many things have changed in your life in a 12-month period, and there's a score for it. And if your score is above 300, there's an 80% chance that within 2 years, you will have a physical or mental health breakdown.
Okay.
And just to give you an idea, like just say moving home, the score is about 30.
Okay.
But when you move home, you may also move workplace or school. Then you have to worry about transport. You're taking a different route. So that the numbers start adding up. The more changes you've had, even if it's positive, it adds to your stress scale. Now imagine that. I'm telling you, I can give you a score and kind of tell that within that score, you're probably going to end up with a mental or physical condition in 2 years. We can actually kind of preempt it.
Okay.
That's big stuff, right?
Absolutely. Absolutely. You know, we always speak of positive stress and negative stress. Is there such a concept?
Yeah. So there is a concept. So we always think of stress as negative, but stress is not inherently negative or positive. It's how we manage it. But there's also a thing called eustress. EU stress, right? And eustress actually is good stress, or stress that is not too much, but enough to motivate you. Because, okay, let's say, our matrics are writing now. If they were not somewhat stressed, would they be motivated to study? They need some stress, right?
Stress, yes.
The problem comes in when we have too much of stress. That's the issue.
Okay. Time for us to visit the marketplace. But before we do that, I want to remind our listeners that this is an interactive program. If you have any questions, you can forward them to us via WhatsApp 060-904-1056. Our topic for discussion is stress management, and our special guest is Dr. Nazia Iran Osman, an independent board-certified clinical psychologist. 060-904-1056.
We'd love to meet you. Pay us a visit. Radio Al-Ansar. At Amina's Wonder Spice, we know that many of you already enjoy the pleasure of cooking with our 100% pure ginger and garlic. Our unique masala paste have created a new dimension and variety to your dishes. For all these reasons and more, we've called it a Wonder Spice. Amina's Wonder Spice, creating a unique taste in a paste. Available throughout South Africa, neighboring countries, and also in the UK. Contact us on 031 577 5023 or www.aminaspice.co.za.
Is your car in need of repairs or some TLC?
At Sham Panel Beaters, we take pride in providing top-notch service for over 40 years.
Conveniently located at 140 Felix Lamini Road, Overport, Durban, we specialize in repairs for both insurance claims and cash jobs.
Enjoy a free diagnostic test, polish, mini valet with every guaranteed repair.
We treat your pride and joy as our own and are approved by all major insurance companies and brokers.
Sham Panel Beaters is also an AA and RMI accredited repairer.
Trust us with your vehicle today.
Why wait for Black Friday? The biggest sale starts now. Simplex Radio's Black November deals are here.
Grab the Hisense 55-inch UHD TV for just 5,699, saving you 1,300 rand.
Save a whopping 10,000 rand on the Hisense 100-inch TV, now only 39,999.
Enjoy 3,000 rand off the Samsung 70-inch UHD TV, now just 9,999. Plus the Samsung 85-inch UHD TV is only 17,999, saving you 5,000 rand.
Don't let these deals slip away. Simplex Radio, the name you can trust.
Come get our butcher's best fillets at Checkers Foods Kawi Park. Enjoy certified halal butchery products like chicken breast fillets, just $64.99 per kg. Bulk lean beef mince, just $89.99 per kg. And leg of lamb, just $149.99 per kg. Deals valid until Tuesday, November 19th. Only at Checkers Foods Kawi Park. Now certified by the NIHT, the National Independent Halal Trust, across our butchery, bakery, and deli.
Radio Al-Ansar.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is stress management, and our special guest is Dr. Nazia Iran Osman, a clinical psychologist. We will welcome your questions via WhatsApp on 060-904-1056. Now, Nazia, how does stress affect the body and mind, both in the short and the long term?
So I was waiting for this question because this is a long one. You're going to have to keep your concentration in.
Okay.
So I think first let's talk about what's the purpose of stress? What's the use of stress, right?
Mm-hmm.
So the function of the stress response was to keep us safe and to get us out of danger fast. That was the purpose of it.
Mm-hmm.
And I think all of us in the body are how do I put it, organisms, right? And we have almost like, I'll compare us to even an animal. If you think about how our body works, we all have, similar mechanisms. So I think about, whenever I want to explain stress, I think about a zebra just grazing in the savannah, going for its grass, enjoying its meal, and then it hears a sound. And it looks up and it picks up this tawny skin color and it goes, shucks, there's a lion.
Okay.
And then what does its body do to prepare? The adrenal glands will release hormones like adrenaline and cortisol. Heart rate will increase. All blood goes to the limbs because it needs to run.
Flight.
Flight. Muscles will contract to activate. And that's why people who are stressed out have such heavy body pains. Like they'll come with, my legs are paining, my shoulders are paining, I'm feeling numbness and tingling. So the animal's pupils will dilate to let in more light. It becomes hypervigilant, becomes aware of every sound. It stops hearing voices. It just looks for sounds that indicate danger. That's why people who are stressed out actually can't get the meaning of what you are saying. Every sound irritates them because they become hypervigilant. The breathing changes. They start taking very shallow breaths. The digestion slows down because if I'm being attacked and I have to run, I'm not going to sit and carry on grazing, right? I'm going to move. Of course. The body suppresses any non-essential functions, such as digestion. Anybody who is stressed out will probably have some GI or gastrointestinal problems, IBS, hernias, whatever, right? Reproduction will not happen. Any sort of growth will not happen. So you won't be healing when you are stressed out. The communication with the brain is the most interesting because the part of the brain that is happening or that's moving or that's working is the reptilian part of the brain. It's very instinctive. Reptiles are not known for their intelligence. So it's not the smart part of the brain.
Okay.
You actually lose contact with the sharp part of the brain, with the thinking, planning, reasoning part of the brain. You're just there to survive.
Okay, yes.
That's it. So that's how the body activates. And that is simplistically your stress response. Now, just say the zebra escapes and it outruns the lion. This is a very fast zebra. So then it goes back to rest and digest. It goes back to eating its grass. It lowers its head. It stops being hypervigilant. And as we say, the parasympathetic nervous system kicks in. And it goes to relaxing and breathing deeply, and all the organs and the hormones go down and it functions as usual. Now, we humans, and there's actually a term that says zebras don't get ulcers because they know how to calm down.
Okay.
But we human get ulcers because we don't know when the danger has passed. We have been chased or something bad happens, but just by our thoughts, we go back into the stress response.
Absolutely.
We struggle to differentiate between real danger, like your employer, scowls, and you go into the stress response. Now imagine the more you go into the stress response, the faster your brain gets wired to be stressed. And we are constantly stressed, Faisal. This is the issue that we're having in the current times.
Okay.
Now imagine the body is built to use this mechanism to keep you safe. But if you're feeling unsafe all the time and your body, the blood's not flowing to the right part of the brain, it's not going to the organs, you're not resting, you're not digesting, what would that do to your system long term?
Absolutely. Adverse effects.
Adverse effects, right? This is where we have heart problems, autoimmune conditions, strokes, depression, anxiety, chronic health conditions. All of this happens because our body is not getting into the healing mode, in the rest, digest, and connect mode. So we can't live in the state. It is really, really very bad for us.
Yeah. So is that how our body and mind is affected?
That's how our body and mind is affected.
I know I asked you about positive and negative stress earlier.
Yeah.
But can stress ever be beneficial, or is it always harmful?
So I think, as I said, it has a place in our world. It has a place in our life. It's there to keep us safe. So yes, it can be beneficial if it's managed. I think the danger comes in with chronic stress. We are not built to constantly be under stress. We are not built for that. But I think the important thing about stress, as I said, it's not about avoiding stress. It's about being stress resilient, which means I get stressed out for something and then I'm very adaptable. I snap back into my baseline. That's the secret here, right? So the more adaptable you are, the more you are able to notice what's happening in your body, the more you're able to come back to your baseline, the more you're able to be mindful of what's going on, the better it is.
So what do you mean by stress management? How are we managing stress? I mean, I know you said how you can adaptable. I'm just trying to see the difference between managing and adapting.
Good. So I guess the big thing in stress is the how. Like, for example, you could be doing the show, but you could be doing it stressfully. You could be talking fast. You could be not enjoying it. Anything we do, we actually have a choice on how we do it, right? So I think that's the big thing. So that's about resilience or adaptability. Now, stress management can also be something else. Like, for example, I could bring up deep breathing or meditation or exercise or, being in a good routine. Now, that's how I manage, or having hobbies or whatever, or having people I can talk to. That's how I manage my stress levels.
So it's more being proactive and taking steps to manage it,
Yeah.
as it is distinguished from adapting to
this thing. Yeah.
Okay.
Like a simple thing. I think about an example. Let's just say if you were running late for the show or a few minutes late. You could do it stressfully. You could drive fast. You could hoot at people. You could, have harsh words before you come in. What state would you be in?
I'll be messed up.
Did it get you any faster here?
No.
No, right? So
not.
it makes no difference.
Yeah.
But if we do it calmly and we go, you know what, let's put this into perspective. I'm going to be late. The person running this place will put a few ads. It's okay. So I think people often forget we do have choice and we can manage our how.
Yeah. What are some signs that someone might be experiencing chronic or harmful levels of stress?
Okay. So I think one of the big things is that sleep is a very huge indicator that someone's not okay or that they're not switching off. So if they are unable to relax, like as I kept on saying, rest and digest, if they're unable to relax, if they're unable to rest, if they're unable to sleep, they might be chronically stressed. They might constantly be tired. Just the thought of doing things is always more exhausting than actually getting it done. So I think that's another, chronically tired. Irritability. I think they will constantly be in a bad mood, constantly snapping at everyone. Difficulty concentrating because their mind is working so fast. They might actually have a very lowered immune system because I told you the cortisol levels are also increased when we are stressed. So the immune system would not be functioning well. So these are the kind of things we look out for someone who's chronically stressed. Burnout can also be another form of being chronically stressed.
Okay.
Yeah.
Okay. Now, when you spoke of sleep, I was smiling.
Yeah, I saw that.
No,
Are you not sleeping, Faizal?
No, I'm not sleeping, no, because the question has come through.
Yeah.
And the question says, Assalamu alaikum wa rahmatullahi wa barakatuh. Is it fine to take the sleeping tablet? She's mentioned the sleeping tablet, Medzol 10 milligrams. I'm not sleeping for about 2 weeks.
Wow.
And she's mentioned another tablet as well, but we obviously can't take any brand names here.
Oh, we're not advertising the tablet.
Yeah.
So unfortunately, and I'm glad that I call this disclaimer at the beginning where I said the difference between a clinical psychologist and a psychiatrist is the psychiatrist will manage medication. Unfortunately, I can't comment on the sleeping tablets or medication. However, 2 weeks of not sleeping is quite concerning. So I would suggest go back to your GP or whoever prescribed the meds. And if that still doesn't work, then do go to a psychiatrist. If you're having other symptoms as well, like maybe other than not having sleep, maybe you're irritable, maybe you're not enjoying things that you used to enjoy, but don't just leave it because sometimes a lack of sleep can be indicative of something a little bit more serious. So make sure you get that checked out. Don't just, suffer in silence. Go and get the help you need.
Absolutely. Just remind our listeners that doctors and guests on Medical Files programs will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility whatsoever for any adverse reaction caused by the advice given on Medical Files. We are discussing stress management. Our special guest is Dr. Iran Osman, a clinical psychologist. And Nazia, how can people differentiate between stress and anxiety? I mean, two different concepts.
So I think with stress, there's usually an external trigger. So there's a deadline, there's a conflict, there's something going on, and the person's body is reacting or is in reaction to this.
Okay.
Now, anxiety, as I define it, it's my own definition, not a textbook one. Anxiety are thoughts about the future, assuming the worst is going to happen and underestimating your own ability to cope.
I love that explanation.
It's a nice one, huh? And it's very simple.
Yes.
So with that, you don't actually need a trigger. Whatever is going on, I keep on going about the how. Whatever is going on, an anxious person will assume the worst. It won't just be bad. It'll be catastrophic. And you know what? I'm not going to be able to cope with it. So can you hear that kind of thinking itself is just so stressful?
Yes.
So it's a chronically anxious state. And if you think about the symptoms of anxiety or a panic attack, I'm sure, Faizal, you've heard about people having heart palpitations, feeling like they can't breathe, sweaty palms, feeling hot, thinking they're going to faint, weakness on the knees. Doesn't that all sound a little bit familiar?
Yes, it does, definitely.
It does, because
Yes.
it's the stress response, right? But again, it's anxious people are chronically in the stress response. And when it exacerbates to that point, we usually see them in the outpatient departments thinking they're having heart attacks or thinking that they're going to die or thinking that something else is going on. So people who are anxious are prone to going into the stress response very quickly.
Is that what you call a panic attack?
That's what you call a panic attack.
Okay. Question has come through. Salams, how does one cope with stress, especially working in toxic environments? Shukran.
Okay. So I think, it's very difficult to cope with stress when you're working in a toxic environment. I'd first look at, let's validate that if you're working in a toxic environment, it is stress inducing. You would be stressed out, right? So first, let's look at what can we do about the toxic environment. Can we call up a meeting? Is this a peer? Can we have a conversation about it? Is there bullying going on? Should we get some help? So what can we do about the toxic environment? That's one. If you can't change the, what's going on, then we need to change your attitude towards it, right? But first, I have to validate if this thing is genuinely toxic, let's do something about the situation. If you really can't do anything about the situation, then we have to change your attitude about it. What's going on? What is in your locus of control? Maybe the other person's behavior is not in your locus of control. What can you do to make your, workplace a bit more pleasant? Do you have hobbies? Do you have other things that actually help you to cope with the stress of work? Do you have people that you can talk to? Do you exercise? Because that could also help with, endorphins that could make you happier. So these kind of things could possibly help.
Thank you for the answer. Are there specific personality types or life circumstances that make people more susceptible to stress?
Okay. So I think we mentioned one where we spoke about the anxious type. So people who are anxious are actually more, susceptible to stress. Then we get our type A, the classic type A. I'm sure you've heard about those ambitious ones who want to attain everything in life is a competition. They're very prone to stress as well. Perfectionism. I know they think being a perfectionist is a great quality, but it's a very distressing kind of quality as well, because the person who has perfectionism thinks that nothing is ever good enough. And they're constantly aiming for higher and higher, and they can really stress themselves out. Our classic people pleasers as well, very prone to stress because they're more focused on what other people will think than what's going on in their own body. And things like this, like the caller that said, they gave that question, and I must thank them for it. Toxic workspaces, difficult people, difficult relationships, chronic illnesses, any change in life, even if it's positive or negative, like getting married or having a baby, great positive change. Retiring, you think of it as a positive change. But these also create stress. So any kind of change in life can also create stress.
Yeah, the change is a quite important one, because a lot of people get stressed out because they can't deal with the change in situation.
Yeah.
And I think also sometimes creates a lot of anxiety as well.
Yeah. And they look forward to it, and they think, hey, but I was looking forward to retire, or I was looking forward to the baby. Why am I feeling so stressed out?
Absolutely. Now, what are some of the most effective strategies for managing day-to-day stress?
Okay. So I'm not sure if any of our listeners, or Faisal, you've heard of this term, the vagus nerve.
No.
Have you heard of the vagus nerve?
No.
So the vagus nerve is very big. And if you Google it, you'll see a whole lot of strategies on how to calm the system down. We use the vagus nerve, which is, as I used the word earlier, it calms the it uses the parasympathetic nervous system to calm the nervous system down, to calm the body down. So the opposite of the stress response is the rest, digest, and connect. And the way we do this is, I've already started throwing clues at it. We use the body or somatic techniques to calm the brain down. So it's called the bottom-up approach. You know when I said when people get stressed out, they get into the reptilian brain, they get into the brain where they can't connect to the very smart part of themselves. So in that state, if someone says, calm down, man, why are you making a mountain out of a molehill? Nobody in the history of the universe has ever calmed down when you say calm down.
Yes, of course.
What you do is maybe you give them a cool glass of water, or you get them into the shower, or you get them to breathe, or you get them to cool off in some way, or you get them to move into another room, or you get them to change space. So we use somatic techniques or body techniques to actually get someone to calm down, because they're not linked to the logical part of their brain. So these are some of the techniques we can use to calm someone down.
And what's the modern term for these things, or the trending term?
The trending term.
Yeah.
You tell me.
Take a chill pill.
Take a chill pill. What a lovely one. But you know, if we can,
Yeah.
once they've calmed down, once you've got them to, or even walk it off. You know that term, walk it off.
Yes.
Yes, exercise. So once you get them to get out of that activated state, then you can talk. Then you can say, hey, let's talk about how you've coped with these things in the past. And we get them to link up with, you know what, you've done this in the past, you can do it again. Let's be positive. Let's look at your faith, your iman. Let's be hopeful about this. I think a very big thing is also having safe relationships.
Very important.
Very important. Wherever you are, whatever you're going through, if people are going to judge you and criticize you, that stress response is not gonna get any better. But if you have someone who holds your hand, who looks you in the eye and goes, listen, let's just sit together for a bit. Let's talk about this, and you feel safe, you will calm down. Yeah.
A question has come through. It's more a medical question, so I'm not sure you deal with it, but I'll just pose it to you. Can sleeping tablets give clots in the brain?
Oh, word. Okay. We should have a psychiatrist on the show as well. Unfortunately, I can't answer that question. To the best of my knowledge, I don't think it would, but yeah.
Okay, no, thanks for that. Now, 06090411056. Any questions, you may forward them to us via WhatsApp, 06090411056. Now, could you share some stress management techniques that listeners could practice in real time during this interview?
Yeah, you're really challenging me. Hey?
No,
we should have this early in the morning, ready for your questions. Okay, so I think a very simple technique is the breath. So we call the breath the remote control of the body, because no animal, you're talking about the zebra who's being chased. No animal, no organism will do deep breathing if they are unsafe. So when we breathe in deeply, we're letting the body and mind know you're safe now. So I'm going to do a very simple technique with you guys. I'm going to do one and just, count you through it. But you can do just a few. Even if you do 3 of these, the body will start calming down. So it works something like this. You breathe in for 4.
Okay.
And then you hold for 2.
Okay.
And then you breathe out for 6.
4, 2, 6. Okay.
4 to 6,
okay.
Right?
Okay.
Even if you forget the number, it's okay. The whole trick is you breathe in, you pause, and you breathe out for longer. That's it. So whether you want to do a 5-2-7, a 5-3-9, whatever your number is, when you breathe in and you pause, the pause, actually, when you slow your breathing down, you're slowing your heart rate down.
Okay.
So if you're palpitating, or if you're having, if you're having a classic panic attack, it will help your heart rate to calm down. And the longer out breath is signaling to the body, we're okay now. Right? Yeah. I'm going to do another very simple one with you, and it's called the progressive muscle relaxation. If you have panic attacks, if you suffer from anxiety, this is a lovely one. You can go and Google it. You're going to have, there are many audios out there, and you can actually choose the voice you want to listen to. But it works something like this. And I spoke about this bottom-up approach of how we get the body to relax because we're not in touch with the other part of the brain. So this is a lovely way of doing it. I've had such good, responses with patients with this. Just doing this itself is enough to help someone who's chronically stressed.
Okay. So
it works something like this. And as you said, progressive muscle relaxation or paired muscle relaxation. You start from the feet and we go, okay, I'm going to do a little bit on you, right?
Okay.
I want you to focus on your feet and become aware of the sensations of your feet. And then I want you to stress your feet. So I want to tense your feet and relax. Okay. And then we take it all the way up. So we go up to maybe your calves and we become aware of the sensations that are in the calves and tense it and relax. A very easy one to do are the shoulders, because then you can actually see it, right?
Yes.
So take your shoulders, just become aware of your shoulders. I can see you straightening it up already.
Yes, because I was slouching.
Because we don't realize most of us carry a lot of tension around the shoulders and the neck, because when we are stressed out, remember, all the blood is flowing up to that, right? So I want you to take your shoulders up to your ears, like you're really stressed out.
Okay. I'm being watched on Facebook.
And you're being watched, and drop it and relax.
Okay.
How's that?
Great.
Yeah. So if you can't do the whole progressive muscle relaxations, just do your shoulders.
Yeah.
And I'm sure I can see you're looking straighter already.
Yeah,
so you're welcome.
Thank you for that. Okay. Now, how important is self-care in managing stress? And what does it look like in practical terms?
Okay. So I think self-care is another one of those catchphrases, right? And People think self-care is all about being selfish, but it's not. I think it's part of self-preservation. And self-care is not just about bubble baths and spas, though I think as females, we're very open to that. It's about taking care of yourself physically, emotionally, and mentally. It's about doing all those things that you need to stay healthy. It's about getting enough sleep. It's about nutritious meals. It's about engaging in physical activities. It's about having hobbies that will help you to calm down. It's about, these hobbies. We keep on talking about hobbies. Why are hobbies so important? When you get into something that you enjoy, you get into what we call a flow state where you forget about time.
Okay.
And these kind of activities refuel you. So whether it's crocheting, whether it's archery, whether it's running, we need these kind of activities to help refuel us. Another big thing about self-care, huge part, is saying no. Is saying no before your body goes into an overwhelmed state. So I think a big part about self-care is boundaries. And letting people know, like, how we had that lady, the person who brought that question about the toxic workspace. Her having boundaries with the people who are creating this toxicity would be a huge part of her self-care. Or being assertive and telling them where to, get off. Huge part of self-care.
Yeah, in fact, that's a huge problem. So, you don't know how to say no. You want to please everybody, and at the end of the day, you're just affecting yourself.
Yeah, and it's not about being aggressive. People think, look, I know there's a cost to saying no.
Yes.
Because when you say no, people get offended. That's the truth. It's hard to say no. So always say, aim for biding time. Say, can I think about it? I'll get back to you. By that time, the person already creates another plan. So maybe that's a subtle way of doing it. Just bide your time. It's about respecting yourself and respecting the other.
Absolutely. Because no use taking on something that you can't do. Taking it for the sake of doing it and then make a mess of it.
But then what happens? You make a mess of it, or you do it resentfully. You do it and then you grudge the person. And how could they be so inconsiderate? But their job is not to consider you. Your job is to consider you.
Absolutely. We'll halt at that. Take a quick break. We'll continue on the other side of this, inshallah.
Famine, conflict, and severe economic decline make the humanitarian crisis in Yemen the worst in the world. More than 20 million Yemenis do not know where their next meal is coming from, and over 10 million are suffering extreme levels of hunger. With your support, the Al Imdad Foundation delivers essential food aid to starving Yemeni communities. It's a question of survival. So let's do what's right. Donate online at alimdad.com or call 0861 786 243 for more information.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment, Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment, Recovery and Wellness Center, the addiction recovery specialist, on 031 563 0751.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport.
Kenfield Auto. Bismillahirrahmanirrahim. ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto.
Radio Al Ansar, Durban, 90.4 FM. Peter Maritzburg, 105.6 FM.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is stress management, and our special guest this evening is Dr. Nazia Iran Osman, a clinical psychologist. Now, there's a comment, if I can call it, that's come through from one of our listeners, and he says that breath and posture is vital.
Yeah.
You have a comment on that?
I think that, thank you so much for that, because as much as we speak about breath, posture is another really critical one. And I think you were confessing, and we caught you on air with that, or maybe we didn't, about how, sometimes when when we're stressed out, we slouch. Like our shoulders go up and we get hunched. And, there is even a thing called the depressed posture.
Okay.
Where if people are depressed, they sit in a specific way. Their head will be hanging low. And if you hold that posture for long enough, you will feel sad. And I think it's called the Alexander technique, or these power postures, and that the name evades me. But basically, there's a whole lot of therapies that are actually, or even if you talk about laughter therapy, or I think there's laughing yoga as well, where if you just laugh, the yogis have found that your blood pressure reduces.
Okay.
And if you hold a posture and you smile, even though you're not in a good mood, it actually tricks your brain into assuming that you are happy.
So are you suggesting that if I'm feeling depressed or stressed out, go to a comedian rather than a psychologist?
Listen, I would never say that on air because I wouldn't have a job. So that's a joke, right?
Yes, of course, it has to be. Okay. You dealt with breath and posture?
Yeah.
Okay, excellent. Now, how does chronic stress impact mental health? And can it lead to conditions like depression or anxiety disorders?
Yeah, so I think chronic stress definitely has an impact on mental health and physical health. And, as I stated, when you are chronically in a state of stress, you are not connecting, your muscles are not relaxing, you are not sleeping peacefully, you can't concentrate, you're constantly looking for where's the danger. And as you said, anxiety is a state of fear, looking for danger all the time. You will definitely be depressive. Because depression is a state where you are sad, you are irritable, you are angry, you can't sleep, right? And if you are constantly stressed, you're constantly anxious, you will be depressed because there's a sense of helplessness and despondency, and the brain can get tired of constantly looking for danger. So these things definitely make you prone to mental health conditions. And the thing with stress is, Faisal, whatever you have, let's just say you have a heart condition. Whatever condition you have, stress can exacerbate it. Whether it's diabetes, whether it's blood pressure, whether it's heart, whether it's stroke, whether it's mental health. Whatever you have, how many people are, or all folks will always say, what's wrong? You're stressed.
You're stressed.
Even if you have a headache, what's wrong? What's troubling you? So I think they had some wisdom to them. Whatever you have, stress will exacerbate it.
No, so one has to be cautious and one has to control
Your stress
the
levels.
stress levels.
And
Absolutely.
I think we have to just mind our words there. It is very difficult to manage our stress in our lives. And I think it's not just the stress or what happens, it's how we think of it as well. But if we see stress as part of our lives, because you can't actually control the traffic on the road. You can't actually control your employer who's cheeky.
But you can plan yourself. You know that the traffic is bad at 8 o'clock in the morning, you leave at 10 past 8.
Then you look at your locus of control, and that will help manage your stress, right?
Because many of us bring stress upon ourselves.
Yeah.
We don't manage our time, we don't plan ourselves, etc. And then we work on the crisis management, and then we're stressed out.
Yeah. So I think you've used very important words. We are very reactionary, and we're not as proactive as we could be.
Now, what role does therapy or counseling play in helping individuals to manage their stress?
Okay, so I have to say therapy works as I'm a therapist. But I think therapy is extremely effective for managing stress, simply because we allow a safe space for the individual to talk about what's going on, right? And to help them find strategies that are unique for them, that will work for them. We have some lovely therapies as well. Like I'm sure most people have heard about CBT, cognitive behavior therapy. And that's the one where we use, we help reframe negative thought patterns. We look at what thought patterns are possibly leading to stress. Like I mentioned, one, catastrophizing. Or personalizing. Like if I didn't smile at you, it might be that I didn't see you. But if you think she's not smiling at me because she got some offense or whatever, right? You're going to stress yourself out. So there's certain type of thinking patterns or cognitive distortions, we call it, that would stress someone out. My personal favorite is mindfulness, which is basically learning to be in the present moment, being very aware of your body and not judging yourself, but just noticing what state you're in and being able to observe yourself. Like, I'm irritable today, or I have a pain in my chest, or what's going on here, or I'm stressed out, my shoulders are going up, or I'm getting angry, my tone of my voice is rising. So we can actually do something about it if we are in a state of observation.
And how can people identify when it's time to seek professional help for the stress levels?
I think when they either have too much of personal distress, like they're not as happy as they used to be and they are distressed, or it's impeding their daily functioning. They're unable to do what they used to do before. Maybe they used to be able to cope with work and now they can't. They're forgetting or they're not sleeping. They're not managing what they used to before. So if you are not feeling yourself, then it's time to reach out for help.
You use the word they're forgetting.
Yeah.
What happens if you're constantly forgetting important stuff? I mean, and also basic common stuff. For example, I know you for a while, but I just forget your name.
Yeah.
Is that also caused by stress?
So look, it can be caused by stress and anxiety, but you have to look at the age as well, because we also have to rule out if it's an older person, is it dementia? Depression can also cause things like forgetfulness. But I think, if there's no organic condition, we can also look at, we have so much of information overload, and there's a thing called digital dementia. Like before we used to remember phone numbers.
Mm-hmm.
I mean, I can remember my uncle's phone number when I was a child, like 9 years old, I knew the number.
Mm-hmm.
You're asking my own daughter's number, I don't know it.
No, because
the cell phone stores it, right?
You just got to save this daughter. Every time you want to talk to her, go to DA and you
Absolutely,
got it.
there we go. So there is such a thing as digital dementia. But if someone at a certain age is forgetting, do get it checked up. So just so we rule out that it's nothing more sinister.
Mm-hmm, mm-hmm. But I like the way you spoke of the numbers, because that's like history. There's a time you can walk and you know exactly whose number it is, even with the dialing code as well.
031 on it.
031. Yeah. And now, I mean, the other day, okay, I'm not going to go in here.
No, but you look how common this is.
Mm-hmm,
like, I think, I hate to use the word, but we're actually becoming a bit sillier because we're looking at our phone or our devices to do all the work for us.
Mm-hmm,
but the brain is a muscle. If you're not going to use it, you're not going to be able to focus. You're not going to be able to remember.
Mm-hmm, mm-hmm. And now we have some friends in AI as well. So
so whatever brain we've been using, unfortunately.
Yes. Now, how does stress manifest differently across age groups, genders, or cultural backgrounds?
Okay. So I think, if we look at children, children who are going through stress will either internalize or externalize. So they'll either keep quiet and take it in, or they'll start acting out or being rude or being defiant. And that's where the parent wants to preach and correct them. But it may be a time to actually connect with them and go, hey, this is not your normal behavior. What's going on? So a child that is what we would call attention seeking is actually connection seeking. So when your child's acting out, first take a step back, actually check what could be going on with this kid, because they're not normally like this, right? Adults now will experience or they often will not say, I'm feeling stressed out, or I'm feeling upset, or I'm feeling sad. They'll describe it in physical symptoms. They won't say I'm overwhelmed. They'll say my head is paining. They won't say I'm stressed out. They'll say, I think I have a chest ache. So you'll have to hear out for the physical symptoms, because somehow we are more comfortable talking in physical terms than talking in emotional terms.
Yes, of course.
So, women, and we're better at talking things out. So when we're stressed out, we will either go and say, looking at me surprised.
No, I've never heard correctly. You said talking things out or crying things out?
Oh, both of it. We're comfortable showing emotions. We're comfortable crying, right?
Right. No, this is clarification.
Yes, are you listening? I think you're going to get into trouble. I'm just saying. But women are more comfortable crying. Women are more comfortable talking. They can seek out for help. But men, on the other hand, I think that classic example, they don't like asking even for directions.
Yes.
So they don't reach out for help. Our society does not allow them to cry. So they are very uncomfortable. I mean, what emotion are men allowed? Only anger, right?
I don't know.
Are you saying you don't know? Okay.
I'm not going to comment on that. Yeah, but you're right. We have a problem that we can't sort of let out our emotions. We've got to just keep it within us.
Yeah, and I think the sad part is that many, especially I'm going into men, because I think we don't allow them to speak themselves through. When they are stressed out, they'll be irritable, but it's hard for them to actually put into terms, you know what? I need a break, or I need help. And this is where, as women, we can actually come and go, listen, you're looking more irritable. Are you okay? Are you tired? Like, we can sometimes give benefit of doubt and help our men folk by putting the words for it.
Absolutely. Absolutely. Okay, we've got like 2 minutes to round up.
Yeah.
So I've got a few more questions to pose to you. But before I do that, I'm sure you have a message for our listeners.
Yeah.
Let's go for it.
Okay, so stress is an unavoidable part of life. So stop trying to lead a stress-free life. Look for a life of meaning. A life of meaning may have stress in it, but it'll be worthwhile. So try to look for your values and meaning. Stress is just stress. You learn how to handle it.
Well, let's hope we can learn. I still got a minute or two now. Tell us something about yourself. If you want to contact you, or where can people reach out to you for guidance, etc.?
Okay. So you're welcome to visit my page, kznpsychologist.co.za. That's my website. I'm very active on social media, especially Instagram. Nazia Osman 9. I often put stuff, as I'm speaking to you, I often put stuff that I've learned from my patients or that I've picked up in therapy. So you're welcome to reach out on that platform. If you want therapy, then you can always contact my rooms at 083-786-3437.
Nazia, thank you very much for joining me in the program this evening. And thank you for the information that you've shared with us. I've certainly benefited. And all the engineer or the technicians at the various radio stations, thank you very much for the sterling piece of work that you have done. And I'll be back with you, inshallah, in 2 weeks' time on Medical Files. So till then, for myself, Faizal MJ Suleman, do have a wonderful week. Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic global perspective. This is Al Ansar